Welcome to Through the Lens of Astrology. I'm your host, Heather Arielle. Today, my guest is Dr. Jeffrey Dann, creator of the Koshi Balancing System, an integrative Japanese approach to holistic healing. And he's going to share with us some very powerful acupressure points that, when stimulated, bring great healing a little later in the show. But before we get started, take a minute to follow me on Instagram, subscribe to my YouTube channel. And right now, we have a special promotion for the month of October. When you buy my Oracle deck, The Fundamentals of Astrology, from Amazon, you will receive $75 off a personal reading with me. It's available through Prime, so you'll even get free shipping and you can get it right away. Now, Jeffrey Dann has developed an integrative approach to mind body wellness. He studied acupuncture in Beijing, Hong Kong, and Hawaii in the 80s, structural acupuncture and movement therapy in the 90s. And he started to put together the Koshi Balancing System in the early 2000s, which is the culmination of Dann's never ending passion to deepen his holistic education, while also teaching acupuncturists and body workers how to integrate manual medicine with the structural foundations of traditional East Asian medicine. Dr. Jeffrey Dann, welcome to the program.
Oh, thank you so much for the lovely introduction as
Oh, well,
well.
thank you. Well, I am so excited to have you here because I am a huge fan of acupuncture in general. Now, I've only ever had the Chinese acupuncture, and I know what you do is way more complicated than
Yeah.
that. But I'm also just a big fan of Eastern medicine because it's all about prevention. So I just thought maybe we can start with you just share some of the key benefits to Eastern medicine and the key differences between Eastern and Western medicine.
So, how to explain briefly the difference between uh, traditional Asian medicine, East Asian medicine, and Western medicine? Western medicine took its modern form at the beginning of the 20th century with surgery.
Mm.
And then in the 1930s and 40s, with the evolution of antibiotics, Western medicine became primarily concerned with crisis intervention, with surgical and pharmaceutical approaches to disease. But it lacked the idea of vitality or health. So someone could have a really normal blood work or even x-ray, but things don't feel right. You don't feel vital, you don't feel healthy. Western medicine really focuses on disease. Asian medicine focuses on disease, but it feels that it's most important that people find their ways to build their own vitality, to build their health, and have prevention. So for example, breath work, diet, movement, these are all foundational in traditional East Asian medicine. Western medicine still hasn't gotten there
It's still
with that.
catching up. It's still
Yeah.
catching up.
Hey, if I break a leg, I'll go to the hospital. But
Absolutely,
you
absolutely.
know,
We
yeah,
do need that crisis intervention sometimes. So
that's
there are
right.
benefits to both. Now, acupuncture. Okay, Chinese acupuncture, and that's the only kind that I've had. When I go to my acupuncturist, I have to stick out my tongue and then she takes my pulse. But
Right.
I know that there are huge differences between the Chinese and the Japanese, even though I've never had the Japanese. Can you talk a
Mhm.
little bit about the hard versus soft? Because there's a much apparently softer approach to the Japanese acupuncture.
Yes, and it's interesting how that developed. And one of the reasons was in the 17th century in Japan, they found that blind body workers and blind acupuncturists had a sensitivity in their hands for palpation. And they found they didn't need to do strong, deep hard needling, because the modern form of acupuncture that has spread internationally and is the standard in the United States was developed for hard body laborers and industrial workers. Now, Japan modernized quite a bit before China, and they became urban office workers, sedentary. The diets changed with the internet, so that they found that the techniques that supported an urban, sedentary, really different type of diet and nutrition responded better to strong, harsh needling. And we found that this is, I think, the mind body of our American population tends to be more urban, has a very different diet than what the farmers would eat. Sleep patterns are different, their immune systems. So, for example, on the size of the acupuncture needle, the Chinese use something that's a little bit bigger than a diabetic needle that people would give themselves their own insulin injection. So that would be, let's say, a 32 gauge needle. A hypodermic needle the regular doctor gives you is an 18 gauge. The higher the number, the thinner the needle.
Oh,
We,
okay.
we use a 44 gauge needle, which is about as thin as a hair, and is very gentle stimulation because it affects the nervous system in a different way, in a different holistic way than the stronger needling, which goes to the muscle layer. If you got a bad muscle sprain in your buttocks, then maybe a deep needle is good. But if you're trying to balance energy, it's a very different type of stimulation that supports and balances breath, body, blood circulation, and a sense of well-being. You never, when I taught in China, they could not imagine acupuncture, which didn't have like a strong response. Oh, now we've got the chi. But
Okay.
the Japanese feel the acupuncturist wants to feel the chi. You don't have to feel. We want you to be totally relaxed.
Well,
Nothing
I
should
think
be.
I think that's a great point you're making, because when people ask me, "Well, what is acupuncture like?" Isn't it painful? And sometimes you do feel it. So that's going to be, if I try the Japanese acupuncture, it's much softer. I'm not going to feel any pain ever. That's
Yeah,
a
true.
really good point to make. I
Yeah.
also love that you brought in the historical perspective. So that's really fascinating. The hard bodies needed the harder needles, and that there's a real historical perspective, a reason for why the softer approach developed, and that blind people contributed to the development. I mean, that's fascinating.
Yeah, when Helen Keller, who is the mother of blind society and therapy, she went to Japan in, I believe, 1905. And she was blown away because there was a whole profession and field for people without sight to be body workers, the shiatsu therapists and acupuncturists. And here's another difference, which I think is interesting
Okay.
for you and your people, is that the Chinese feel that when we're out of balance, there are more blockages. And blockages require a strong technique to disperse, to break up the contraction. The Japanese feel that it's more important to find what's deficient, what is there not enough of, rather than where is there too much. So the metaphor that I love that my teacher gave is, if the garbage men go on strike and the garbage starts to build up on the sidewalk, that's the excess. We can take a little bulldozer and bulldoze the sidewalk and get rid of the garbage. That it'd be the hard technique. The
Right.
Japanese say, what's the deficiency? Oh, it's the pay. If we give them a raise, then the body will take care of the excess and balance it out. So we're always finding, where is there not enough? And we treat that first. And then sometimes we do need to do different types of techniques to move it. But the foundation is the person's chi full first? Or do they have an internal healing response to what we're doing rather than just pushing through?
So I love that. Blockages versus deficiencies. When you talk about identifying deficiencies, you're really getting to the root of the problem. I love that. So that it doesn't keep happening. Whereas the
That's
blockage,
right.
okay, you clear it, but then I become dependent on the doctor. I have to go back every week to clear the blockage. Whereas what you're saying, if you
Hmm.
can identify the deficiency, then major changes can be made to then prevent future blockages from happening.
Right. So we describe that as treating the root and the branch. The root is the underlying energetic imbalance.
Mhm.
And if we treat that first and then go for the branch is the actual reasons that the person came in to see you. Oh, I've got a headache, I've got a neck pain. We want to treat that, but we want them to have the best internal natural response, and that's by balancing their pulse and the energetic relationship among the meridians and the organs.
Now, I also know that, I mean, there's a lot of research saying that sitting is not good for us. And I want
Hmm.
you to talk about how this is connected to what you do, because I know the hips and the abdomen, that's a very significant region for healing. And so
Hmm.
about creating that flow, can you just talk about how is, what is the importance of that? And also, because I don't speak Japanese, but from what I understand, the word koshi references the hips, but it's not a direct translation. So can you just maybe describe the importance of that?
Yeah, sure. You know, in English, it's interesting. People say hips, they're
Okay.
often pointing to their buttocks, whereas actually the hips are in the front of the pelvis, not the back. We don't have a good, in English, a good idea of the relationship of the whole pelvis to the spine. So you can think of the koshi as being the center wheel of the body that integrates the lower body to the upper body. That's where strength and movement has to come through. So anyone who's done dance or practice martial arts, you know, they're always telling you if you're, let's say, if you're doing a martial art, if you're not hitting with your hand, you're hitting with your whole body because your pelvis, your koshi is putting the power into it.
Okay.
So it's really, and if we think in terms of the chakra system, that, for example, many of your listeners are more familiar with that, the pelvic area holds the first and the second chakras. That's survival, that's core primal energy. So the energy has to flow from that into the heart,
Oh.
into the arms, into the legs. So the that is the central area where energy and movement initiate from.
Mm. Now, yeah, I just love that you've created a whole new healing modality. You're a true pioneer. So just go ahead and describe the Koshi balancing system. What inspired you to create it and just behind it, the diagnostic tools behind it?
I can give you a very brief personal story.
Okay. I'm all about
So,
personal, practical, powerful.
so the week before I was going to Japan, well, actually, even before that, I was a young guy in my 20s, and the first time I ever did yoga, I knew nothing about it, and I saw the teacher go into a full lotus position, and just being young and dumb, I said, "Oh, I can do that," and I just muscled it, and I tore the meniscus in my knee.
Okay.
Yeah. And I really wasn't aware of it because I wasn't doing a lot of physical challenges other than that at the time. So right before at a going away party, when I was leaving for Japan, I was dancing with great vigor, trying to impress a young lady. And all of a sudden I'm on the floor and my knee had dislocated, and popped it back into position, and then went to a couple of doctors following that weekend, they said, "Oh, you've got a torn medial meniscus, and we can operate on you next week." I said, "Oh, next week I'm leaving for Japan for several years, so that won't work." And when I got to Japan, I lived in a traditional apartment, not a single chair, no couches. You had to sit on the floor, on the tatami. And every time I would sit cross-legged, my knee would dislocate
Oh my gosh.
and I'd have to pop it back in. So at the language school I was going to in Kyoto, they said, "Oh, we've got a really great traditional doctor. He's helped a lot of our foreign students. Go see him." So I went to see him, and he said, after he checked me out, problem's not your knee. It's your koshi. There's that word again. And your hamstrings are tight. Your koshi is twisted. Your hamstrings are too tight. The knee is just the end result of that imbalance. Come and see me twice a week for a number of weeks, and I think I can help you. Well, 45 years later, I've never needed that surgery on that knee, and he became my first teacher.
Oh my goodness.
So that was really how I got into it. And then in the martial arts, my teacher also was a body worker of a type that's not very well known outside of Japan called Sei Tai.
Mm.
Many more people are familiar with shiatsu or
Yes.
amma.
Sure.
Sei Tai has a very structural alignment
Mm.
orientation. So my teacher really emphasized that. And I began to see more and more of people's problems. For example, if you have a neck problem or a shoulder problem, they generally people would focus on that, but you have to see, is there support from below?
Mm.
If your pelvis is twisted, then your right side and left side become more asymmetrical. It can affect the alignment of your shoulders, and from there your neck.
Now,
So that
does that involve? I know one thing. Now, I can't wait. I'm gonna get an appointment with you the next time I'm in Boulder.
okay,
Haven't
great.
had an experience yet, but from what I understand, you put your palm on the head, and then the way the head falls tells you something about the fascia.
Oh, that's
Sounds
fascinating. Yes.
fascinating.
So that comes from the osteopathic tradition of listening to the fascial pulls within the body. But the point on the crown of the head, where the crown chakra uh, is interestingly called and translates from the Chinese as the 100 meeting points,
Mm.
meaning that all the energetic pathways in the body meet at the crown of the head. So if you very gently listen with your palm, which is also the heart, by the way, the center of the heart is of the palm represents the one of the key points of the heart meridian. So that's how we feel. So when people pray and then put their hands together or clap their hands, this is heart stimulation when
Oh,
we're rubbing our palms. And I got a good business deal coming, right?
yes.
So you're really stimulating heart. So with this heart sensor, we
Okay.
listen to the 100 meetings, and you can feel, am I pulled forward or backward, right or left? How far? To what meridian and what organ is saying, hey, pay attention to me.
Oh my gosh,
That's the listening. Yeah.
and wow, so the pulses, the tongue, the palm on the head, and you also even said voices, the sound of someone's voice, the tone of someone's voice is connected. So a certain type of maybe shouting is connected to the liver, or you can say, but
Yes.
that's fascinating because I'm very sensitive to how people sound. And it's
Yeah.
amazing that you can actually, it's going to reveal something about that person's health.
And you have a very lilting voice. You have a spleen voice.
Okay.
That's the earth
Oh,
voice.
that's good. I'm just going to say that that's good.
Yeah. Now a kidney type person would have a groaning voice.
Ooh.
There's a tone of groaning. The spleen stomach has a lilting voice. The lung may have a little bit of a whining or cry, a little sad tone to the voice. The heart is overexcited. People talk real fast with excitement. So yeah, the the quality of the voice. The picture of the tongue tells us about the microcirculation of the digestive system. The pulse tells us about the autonomic nervous system and all of the internal organs. The fascia tells us about the muscular skeletal part. So there are many layers that they all fit together.
I love how nuanced it is. There are so many layers. And also, are there 12 pulses? I know there are a lot. How many pulses are there that you?
Yeah, well, they in the Chinese and Japanese system, we have 3 positions on the right wrist and 3 positions on the left. So that's 6. But you have a superficial, a very light touch on the surface. That's your yang energy pulse reading. And if you go deeper, that's the yin organ pulse readings.
Oh my.
And I will say this too, we also in Japanese body work and acupuncture do a lot of abdominal palpation because so much of our emotional and energetic state, we know now, even from Western medicine, comes from the internal organs. We know now that there's, for example, much more serotonin in the digestive system than in the brain. So much of our, what we think is our mood, our emotion, our mental process is responses to how our liver is feeling, how our heart is feeling, how our digestive, those are unconscious, but the brain interprets those in an emotional way so that we can treat the spirit and treat the emotions, not only from, let's say, a cerebral psychoanalytic way, but really by balancing the energy of the organs and the meridians, then people feel vital, they feel healthy, they feel balanced.
Oh,
And you know, how many times have we gone to Western doctors? They when they take the pulse, they only take how fast it is. They don't interpret the meaning. Is it hard? Is it soft? Is it superficial? Is it deep? All of these have very important meanings for us.
and
And when,
I
go
also
ahead.
love the idea of the living points that every time you see a patient, you're gonna be you're going to be doing your palpations, really feeling, and the points are living. Can you just talk a little
Yes,
bit more about that, because that's so different from the Chinese?
surely. Yeah, we don't have a strict anatomical point location. For example, someone comes with an elbow problem. They're a carpenter versus a violinist versus a tennis player. All of them have an elbow problem, but you have to find the exact point that fits that person because of what their lifestyle is.
Mm.
So the points are have to be found on the person, not determined by the chart.
Oh, wow. That's
Yeah.
really, wow. That's amazing. Now, you also you start at the feet. If once
Yes.
somebody's on the table, you look at the feet and you combine the structural components with the energetic components. Can
Yes.
you talk a
Yeah.
little bit about that?
Yeah. Sure. You'll have to excuse my anthropological
Oh, I love
orientation.
it. Yeah, no, bring it on.
We as humans are designed to be on 2 feet and to be erect, so that how we are in the field of gravity, and it's so interesting. Think of the word understanding. To stand under, you have understanding when your feet are grounded.
Mm.
If okay, if your feet are not grounded, if you have an ankle that's giving you a problem, it creates a pathway of compensation and distortion, which can go right up to the head and neck. So some people can have, let's say, a headache, and you don't get relieve it by treating the head. Where along the pathway is the energy being obstructed? Could be from that ankle sprain you had,
Oh.
could be from your low back sprain. So that where the locale of the point problem is, you have to see, is there support coming from underneath? The other important thing is that we incorporate um, movement into these areas where we find there's restrictions in the quality of movement. So for most of us, if we go to a massage therapist or even most acupuncturists, it's a very passive. The person finds where your imbalances are, they'll treat you, but then you'll get up. But how do you embody and take these changes when you get off the table? So by using the movement therapy as part of it, we are re-educating the person. So not only are they rebalanced, but their muscular emotional system knows how to move. So when they get off the table, they have a different sense of how they're feeling and how it feels to be able to move. It moves our therapy beyond the passive into the active.
Oh, I love that.
Yeah,
Movement from beyond passive into the active. Now, there's
yeah,
also a spiritual component to what you do. Could you bring that in?
yeah. So Western medicine, starting from Descartes and then later with the development of psychoanalysis, is I think, therefore I am. So we in Western medicine have separated most of the medical profession with all its specialties from the psychiatric and psychoanalytic. That, oh, that's a head problem, that's an emotional problem, different than your body problem. Oriental medicine feels they're the two sides of the same coin. You can't separate them out. So when we talk about the spiritual, and this is also very interesting, that Westerners, we put most of our spirit in our heart, in the middle of the chest. In Asian culture, they recognize the heart, but they really put it in the abdomen.
Mm.
And most people anatomically don't realize, in fact, your heart really sits on your diaphragm. And the diaphragm is actually right in contact with your liver and your stomach. So these organs, whether you have a good diaphragmatic breath, whether you have a liver that is elastic and friable and can move, or a stomach which is hard, all these affect our spiritual and emotional. Our heart is affected by how the liver feels, how the stomach feels, how the blood vessels feel. So I would say it's fascinating in that what the Asian way of doing is that they recognize that every organ has its spiritual contribution to the whole of our spirit. So, for example, if someone, take example of the lungs, because we're in the lung season now. The
Oh,
autumn is the lung season. And uh, every organ has a place in the emotional social structure of ancient China. So the heart was the emperor, the liver was the general.
okay.
Okay?
Okay.
Uh,
Hardworking.
yeah, and the stomach was the master of the granary, so that every organ has its own spirit. And so the lung spirit is interesting. They call that the judge.
Oh.
So there are two aspects. When it's an internal, people can judge themselves and be their own worst self-critic. And that means they have a deficient lung energy, which can make them more susceptible to perhaps colds or flus, the quality of their, because they don't have enough and they're critical. There's a kind of collapse of the lung chi. The other side, if it's too much, then what do? They start criticizing other people. That's the other aspect of imbalanced lung, is that the lungs represent the metal element of high standards. So either you apply your high standards to yourself and may find yourself lacking, or you start looking at other people. This is not working because you're doing this, that, and that criticism. So if we can balance the lung energy, then the emotions say, oh, I can see, rather than being critical of you, for example, oh, I see this is your behavior. now I'm not surprised, right? Now I can respond better, that sort of thing.
Oh, I love that. Now, if you're just tuning in, you are listening to Through the Lens of Astrology with Heather Arielle. My guest today is Dr. Jeffrey Dann, and he is the creator of the Koshi Balancing System, an integrative Japanese approach to holistic healing. And coming up, he is going to be sharing some very powerful acupressure points that, when stimulated, will bring great healing. And we're going to get to that a little later in the show. Now, this is the point where I bring in the astrology of either what we're talking about. And when my guest allows, I get to bring in my guest astrology. And Dr. Jeffrey Dann is very generous to share his chart. So let's just bring that in now. Your sun is in Libra, your
Mhm.
moon is in Gemini, and your ascendant, your rising sign is Scorpio. And, I just have to say, one of my all time favorite people is Groucho Marx. And guess what? He has the
I love it.
it's a great combination. But when we talk about Libra energy, oh my gosh, it's all about how to be in balance. It's the only sign that is an inanimate object. It's not an animal. It's the scales. It's how can we bring that harmony, balance in? And I mean, my goodness, that is the absolute essence of what you do, bringing balance to the body. So, in that sense, you're a beautiful example of being an imbalanced Libra. And then when you throw in the intensity of Scorpio rising, now, Scorpio and Libra, they don't naturally go together because, Libra has a desire. They do want things to be peaceful and beautiful. And Scorpio is that underbelly of saying, no, 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 things aren't always peaceful. Sometimes there's some taboo subjects we need to address. And Scorpio energy is the desire to get to the root of a problem. So when you talked about, what you do is not just, I'm not just going to clear a blockage. You figure out the deficiency. You figure out what is causing this blockage and what can someone do to prevent further blockages from happening. I just thought, wow, that's so Scorpio. So, and a lot of healers are Scorpio rising. It allows for the passion, the obsession to be able to say, okay, let's do the research, let's dig deep, let's persevere, and let's get to the bottom of what is really going on. What's causing these misalignments? So I just think that you're a beautiful example of combining that passion of Scorpio with the desire to bring balance and harmony to your surroundings, your environment, to your patients with the Libra energy. And then you throw in that very fun Gemini moon,
Mhm.
which is a playful, curious, communicative moon. You're a great teacher. And you're even, you're teaching all the time. There's a wonderful online class you're offering in November. And I am going to upload those links to Through the Lens of Astrology Facebook group and to the Beacon of Light Radio group on
Mhm.
Facebook. So if you want to sign up for Dr. Dan's class, and it doesn't matter, you can be a medical professional or you could just be interested. You can sign up. He's an amazing teacher. That's that Gemini moon. Gemini gives you the desire to teach what you know. And so
Mhm.
you're really a great example of being in balance with all of those energies. And how do you feel? I mean, how do you feel about your connection to your astrology?
Well, that's very interesting. So I have a question for you,
Okay.
right? Because I like what you said about the Gemini. And I think that sometimes my Gemini quality can lead me astray so that I get interested in too many different things. Or, oh, that's enticing. Oh, that's really interesting. How do I integrate it? So sometimes I think I have to control my Gemini because I think there are so many levels to truth. I've never been a person say, this is the only way.
Well,
And
you brought up a great point. And what you brought up is that between your Gemini moon and your Scorpio ascendant, it actually creates what's called an inconjunct. And this is energy that doesn't naturally blend because they are in different elements. One is water, one is air. They're in different modalities. Scorpio is fixed water versus mutable air. So when you have an inconjunct in your natal chart, you have to consciously blend the two energies. And so sometimes what we do is we bounce back and forth
Hmm.
between the two. And so you're that's what you're responding to because you're so naturally intuitive. But Gemini is that air, and then you double up on the air with your sun. So Libra and
Hmm.
Gemini, and it's very social. It's all about verbal,
Hmm.
about talking, about communicating and teaching. And Gemini it does represent the curiosity, that endless quest of, oh, this is interesting. Oh, but this is interesting too. And oh, that's also interesting. And
Right.
that's just, I like to say, look at your natal birth chart as a beautiful gift you give yourself, and that those are your astrological superpowers. And I'm borrowing the superpower from Michelle Auerbach, a guest I who talks about your superpowers. And when we view it that way, you're going to say, you know what, I'm going to love my curiosity, and I am going to pursue my desire to bring balance and harmony to my surroundings and to myself and to everyone I encounter. And I am going to pursue all of that with the Scorpio passion. So I will
Hmm.
prioritize and I will dig deep, which you have. I think you've blended it beautifully.
Hmm. So I have another question for you about
Okay.
my chart. Many years ago, when
The
I had a
Gemini moon. This
reading,
is hilarious.
yeah.
As you're talking about. Go ahead.
So this friend astrologer said, "Oh, when I see your chart, and I'm seeing if you concur with this, so everything was in the upper, most everything is in the upper hemisphere,
Okay.
and much less in the lower hemisphere of the chart." And I found that this is very true, and I've had to cultivate more stillness and presence to be able to balance my external social excitements, I think.
Well, that's a great point. And it also has to do with that you have the sun and moon in air. Okay. So it's not just
Hmm.
that the energy is above, but that it's also you've got that air. So that combination's absolutely when you have planets above, the focus is outward and you're teaching,
Hmm.
you're sharing, it's your knowledge, everything you have. You're generous with all of your talents and it's going out and
Hmm.
it's going out. And so that's why I do say when people have a lot of air or they have planets above the chart, meditation is one of the
Yes.
things
Hmm.
to incorporate because air equals thoughts, and air signs can have just a lot of thoughts. There's always something going on, and so it's hard to feel that stillness. And so when you
Hmm.
meditate, it allows for the mind. It's like you can unravel any excess stress or grief or any excess energy that may be creating that imbalance. So incorporate meditation, and that will help to bring in the more reflective energy that is more connected to the lower half of a chart.
Yeah, I find that to be very true. And even clinically or therapeutically, it's so easy that someone walks in, you see they've got, let's say, a bad back, and say, I know how to fix that. I'm going to do this and that. No, like my evolution is first listen to what the body has to say rather than think, oh, I know exactly what your problem is. You can't lift this up because that's locked. No, I just want, let's have a conversation. Have your deep soul self
Mm.
and my going into stillness as we make contact. What does your body want to tell me rather than what do I think you need? So that's how I think therapeutically it's important, whether that's going into a meditative state rather than an active state of doing first. To really make that deep connection is essential. I Go ahead. Yeah.
I think that's beautifully put. And that is a gift of the inconjunct as well, because it really does mean you can have that. Scorpio is the most intense energy in the zodiac.
Mm-hmm.
It is deep, profound water feeling passion. And so I really, once you combine that energy, I tell anybody, if look, when you have inconjuncts, find them. They are really
Mm-hmm.
powerful. And a lot of times people don't activate them completely because they don't understand that they're both gifts. You get to open both. You don't have to choose or
Mm-hmm.
bounce back and forth. So I think that was just so beautifully put. When you've got that air, we can get too much in our mind. And
Mm-hmm.
we want to make sure. So, air signs listening, if you're Libra, Aquarius, Gemini, you got a lot of air, make sure that you incorporate those healing techniques to get you out of the mind into your heart or into your abdomen.
Mm-hmm.
Right?
Mm-hmm. Yeah, right.
So then you're
Yeah.
really feeling and being connected to your own intuition.
Mm-hmm.
Now,
Yeah.
go ahead.
It, I think that Oriental medicine ideally wants us as practitioners first to get out of the way,
Mm.
to let the person really speak. And think about how many times we may have gone to a medical doctor for our annual checkup, for example. Do they touch you? Do they
Mm.
examine you? Do they check on how your organs are? Or they say, no, we'll do a blood test and we'll do an x-ray and we'll do a urine test. That's how they determine people now. The real body, the real living soul is not really addressed anymore. That I think Western medicine has lost the manual touch, the importance of the healing touch. And that brings me to the mother's touch.
Oh.
I think I think that the initiation of the healing response starts for every one of us as infants being held by the mother, ideally nursed. And that, all the new research on the vagus nerve system,
Oh.
uh, which have always been mostly related to digestion and restoration. But now we find that the emotional, energetic qualities of attachment, of bonding, of safety, of pleasure and connection come from the stimulation of that vagal, the ventral vagus nervous system, which is the muscles of the face, the tone of the voice, all the things a mom would do while they're holding and
Mm.
talking to the baby and looking and stroking. This is the origin of the healing response.
Oh.
And the more the therapist can, cultivate mother's hand when we touch, to make that initial contact, to be supportive, rather, oh yeah, you've got a really locked up muscle in your trapezius. I'll let me iron it out for you. You know,
I love that. I
yeah.
love that. The mother's hand. Now, I do want to give more information to my listeners how to find out more about Dr. Jeffrey Dann. You can go to alohawellnessboulder.com. He's out of Boulder, Colorado. Koshibalancing.com. And if you can follow him on Instagram, his handle is Koshi Balancing. And again, I'm going to be uploading all of these links and diagrams, all kinds of extra information to those chat groups. So you can also join those groups to get even more information. Now, I did want to ask you, I know that you have had an experience with COVID, and I just thought I wanted to
Mm-hmm.
check in and have you share a little bit about what that experience was like.
Hmm. I'm still processing that.
Okay.
um, in April, I came down with what I'm calling the COVID because I was sick in a way that I'd never been sick before.
Mm.
I didn't get tested because I also feel that many of the tests they rushed out from many different companies had a very poor uh, rating, that often there were many false positives and false negatives. But I could tell that I'd never been sick like this before. I was very careful in my household in terms of how we disinfected everything. What I had a full spectrum of uh, Western nutraceuticals with Chinese herbs. I believe I caught it swimming. I swam in an athletic club that did not use chlorine. It used a kind of salt, which didn't kill. So I think swimming with the master swimmers with the flip turns and lots of aerosol sprays, that is the only way I thought I could get it. And I felt, wow, it's just the remembrance of it. I felt I was punched in the heart.
Oh my gosh.
I'd been working in my garden with potting soils, and I thought at first I had inhaled some particulate matter because all of a sudden I have to sit down. And it passed in about 10 minutes, normal. Next day, it happened again and then again, and more agitation. I never developed some of the symptoms that are more characteristic in the beginning, like a fever, a severe cough. I had mostly breathing problems.
Did you lose your
And
sense of smell?
did I what?
Did you lose
No, I never,
smell?
no. And I think one of the reasons I never lost my smell is that I was a really, and am still, a big believer in how do we reduce viral load. I think this is important for everyone because we know that when people inhale this virus for anywhere from 5 days to 2 weeks, it just cultivates in the sinuses and in the throat until it reaches a critical mass, which is very characteristic of many bacteria as well. And then it penetrates deeper into the body. So we know that the hospital workers that are working with COVID patients 24/7, they have the most severe and serious uh, results, even with all the protective equipment, because their viral load has been much larger. So if we can support our immune system, like things with vitamin D3 and vitamin C, there's a whole spectrum of things that are worthy to consider, uh, and then do some specific things to reduce viral load, then our immune system can deal with this illness much better. So for me, what I did is that I got essential oil snifters. And instead of using essential oils, I used iodine. And if after we go out and shop, I would just sniff some iodine vapors. So if I did breathe in, even with a mask, some aerosol droplets, that I could be reducing some of the viral replication. And we also used Chinese antiviral herbs for neti pot use, so that the nasal passages, the throat, you're continually reducing the cultivation of the virus. So there was that. The breathing problems were pretty significant. I could not sleep at night, couldn't lay down, but I found using a hot steaming bowls of water with a towel over my head and with aromatic like a eucalyptus oil or peppermint oil, that helped dramatically. I did a number of qigong exercises. One of the most wonderful ones, in Chinese medicine or Asian medicine, the idea that much of our immune system is resident on the skin and right underneath this. This is our interface with the outer world, is the skin. And the skin has a direct neurological connection to the brain and to brain function. So there's a whole qigong quality of padai, where you wake up your immune system by percussion, by slapping the body.
Now, I
And
also
this,
do that. That's part of an asana. I do TM, and one of the
uh-huh,
asanas that's connected to that meditation is I cup I take my hand and I cup my arm and my leg, and so I
yeah,
waking up the body.
you're waking up actually the immune system, the lymphatic tissues that are in the skin. And yeah, so there are a lot of self-care things that one can do. The virus, in my experience, it's primarily a respiratory virus, but it searches, once it gets in your body, it searches for wherever you are weak. So the symptoms can be very variable and very changed. So like I had a pretty severe constipation and bloating, and that made the breathing worse because your diaphragm has to descend. But if you're bloated and your liver won't move, you can't get a good breath.
Mm.
I had other times where uh, it attacked my kidney,
Mm.
one kidney, and we would do herbs for the kidney and cleared that. There are other times I had neurological symptoms. So it was very important. There's not a single pathway. All of us are unique, and that's why there's so many different presentations of the virus, of what symptoms, and that each time a new symptom appears, it has to be addressed itself as well as the underlying. So I worked with a very good herbalist, Sharon Weisenbaum, remotely, and she'd do my tongue. I take my own pulse, and every couple of days the formula would change.
Mm.
And yeah, I had unusual dreams. Um, uh, the, the recovery is often slow. And there's now what they're calling the long haulers, of people that they're completely over, it seems, of the active infection, but they have prolonged respiratory problems. Some have cognitive problems. Some have vascular and cardiac problems. So that there's still a lot of important strategies once you're done with the active infection of how do you handle your recovery. Very important. And a lot of the qigong breathing, eating right, getting your blood circulation moving, these are all really important things. And the spiritual part is, I believe this, that illnesses are moments of transformation for our
Yes.
spirit,
Mm.
even cancer,
Yes.
even cancer. So they are a time for us to reevaluate what are we doing with our lives? What do we need to go? Where do we get nourishment and resource and follow that? So rather than say, oh, this was sick, it was horrible, I'm so glad it's over. No, it in a way it's a shamanic ally, because the message of the COVID for me, and I believe for the planet, is slow down. Everything was so overheated in our global world, and extraction of resources and destruction of the environment, that when the virus first hit, the skies got clear,
Yes.
right?
Yes. Yes.
That was the message of the viruses. We as a part of the larger environment need to slow down. And so that is that's a spiritual teaching rather than a rejection and cursing the virus. I'm thanking the virus. I'm thanking I survived and got all better, but it had an important message for me in my daily life.
Well, thank you so much for sharing that. I really wanted you to share that. It's because I feel that it's such an important message, because it is a very complicated, it's still very mysterious. And
Mm-hmm.
everyone, as you said, everyone's having a different response. And I also like how you put it in, you help us to see the bigger picture of illness. We can never forget the spiritual component. So I really appreciate you sharing, going into such detail about your personal experience with COVID. Now,
Mm-hmm.
you have many unique self-care rituals. I do want to talk about some of them. And you do something that I think is really great. You are so intuitive and connected to where you are. You're very present with your energy. Over the years, you transform those self-care rituals, because I know I have clients and they just want to, whatever they were doing in their 20s, they want to be doing in their in their 60s. We have to, different activities suit us at different times in our life. So I know at one point you were doing the kendo and you're a fourth degree black belt, and then you were doing contact improv, and now it's kind of gone into more tai chi. Just share a little bit about the transformation of your own self-care rituals.
Yeah. Well, if you think of the dynamic balance between yin and yang. So when we're young, we're filled with yang energy. this is why it's very interesting. Uh, the Japanese developed the pediatric acupuncture, which is non-insertive. No needles get stuck into kids
Okay.
because their yang energy is so great. It's all surface stimulation,
Oh, okay.
and they respond so quickly. But as we get older, the yang energy begins to diminish, and maybe the yin, the more quiet, receptive. So I can remember when one of our teachers came from China. He said, "Oh my God, America's driving me crazy here. You guys, you all want to calm down. And what do you do to calm down? You go jogging. You find quiet by exhausting your yang energy." He said, "No, we do Qigong, we do Tai Chi, we do yoga. These are all to build the yin to get restoration rather than exhausting ourselves." So, that is an important characteristic. As we get older, the things that we do uh, should be, um, I think we become wiser in our bodies, hopefully.
Hopefully, yes, that's
you
the goal.
know, because I've had patients with knee replacements,
Mm,
and they say, "I don't understand it. I don't do anything. How did I get a degenerative knee?" You got it because you did nothing.
right.
And the other extreme is some people do way too much. So you have to, uh, it takes a certain level of maturity to find balance. So now, as I'm into my 70th decade, I my mantra is appreciate shrinking parameters.
Okay.
So, I mean, to give an example, we have to find what's appropriate for our body. So that, for example, because I was once in a very bad auto accident with whiplash, uh, I I will not ever do mountain biking again.
Oh,
Just too jolting. But I can go for a really nice road bike or on a gravel road. So uh, I won't backpack into the backcountry anymore, but I can do a nice day hike. So and I think I would be hurt myself or be frustrated if I try to do the things I did in my 30s when
right.
I'm in my 70s. It's not going to work. So it's really a spiritual question of how do you find fulfillment and joy that's appropriate to where your mind and body are at in your life cycle.
I think
You
it's a
know.
beautiful message. We all need to be present with our energy. Just be present.
Mm-hmm.
And it's not about
Mm-hmm.
pretending to feel something we don't feel or to do. It's be present. Do that check-in and build
Right.
in the quality and bring balance and harmony. I think it's a beautiful message. Now, I before we we still have a couple minutes left.
Okay.
I would love for you to share a couple of those acupressure points that I can share because that's a big part of my show is every week I bring very practical healing techniques and tools and activities
Mm-hmm.
to my listeners that they can incorporate immediately into their lives. They don't have to buy anything and they can just do it right away. And so I'm always so grateful when a healer comes on and is so generous to share just
Mm-hmm.
a couple of um, acupressure points like this. So you go ahead
Right.
and
So we don't have an independent camera to show you. For example, the one point I want to show everyone.
you can describe it. Yeah.
Uh, yeah. So the stomach meridian,
Okay.
which runs from the top of your head down the front of your body, through the abdomen, through the stomach, through your quads, and into your legs, right down. It's a whole body meridian. And there's a point, very famous point, stomach 36, below the kneecap, not on the bone, but on the muscle, the anterior tibialis, that has the most chi
Ooh.
and the most blood, so that this is the biggest tonification point for not only for digestive, but for movement, for well-being. And that point uh,
So
if
I go
you
to my
go
kneecap. Okay, so my fingers are on my kneecap, and how many fingers do I go below?
just below, go
Okay,
about 4 fingers
so
just
four fingers below
below,
the bottom of my
put your index finger of your kneecap.
okay, okay.
So
And I'll upload
your
diagrams as
top
well, but
index
we'll
finger
do our
is
best.
right against the bottom of your kneecap.
Okay,
Yeah. And then from there, from the little pinky side, go into the muscle and press around. And often you'll find a big nerve point there.
oh my gosh, I totally feel that. Oh, that's amazing. Oh my gosh.
And you feel it,
And I just
point more
massage.
than once.
So and I just massage gently that point.
You
Is that
can,
what I do?
yeah,
Okay.
yeah. And then what you can do, because the meridian goes all the way down that muscle, I like to have people with their opposite leg with
Okay.
the heel. And you can do it sitting, you can do it in the bed. Rub up and down that muscle, and you'll find some very tender spots.
Okay.
These are great vitality points.
Ooh.
If you have diarrhea, if you have constipation, if you have abdominal bloating, if you have low energy, if
Mm.
you hard to get going, the Japanese were great temple pilgrims, and they'd walk all over the country, up and down mountains, and often they would massage or do moxibustion on this
Oh,
for
that's
fatigue to be able to get over the mountain. Probably, yeah.
right. So
So I want to show you that one. Yeah.
go ahead. And did you want to show me
Next.
another
Okay.
one? Okay.
This, yeah. I want to show two more.
Okay, okay, let's do it. Yeah,
So
more
the
the merrier.
so the heart, as I said, the heart rests on the diaphragm.
Okay.
People don't realize they're really actually right in touch with each other. So that meridian, the heart meridian diaphragm, runs right down this midpoint of the inside of your forearm.
Okay.
So if you have insomnia, anxiety,
Insomnia.
excessive thoughts that won't get, you can massage right down the middle of insomnia too. And so you probably know, Heather, that many women, when they're pregnant, get morning sickness, and they have these special copper bracelets.
Oh.
For that point, it's called the inner gate, pericardium 6. So if you look at your wrist
So I'm looking at my wrist and
and
I see
make a fist,
two
see
little
two
tendons.
tendons.
So look at your wrist and you see these two little tendons. And as
Yeah.
I
So
go toward my
about
elbow,
yeah,
I can just feel, oh, wow. Oh my gosh. Okay.
yeah. And so about 3 fingers from your wrist crease, and then go between the tendons for calming the spirit. This is a big
Ooh, calming
spirit calming point.
spirit.
Yeah, anxiety, insomnia, nervousness, all of these are very much used.
Oh, I love
So
that.
this one can go good. If you think of the heart, that's the fire element.
Mm,
So what balances the fire element is the water.
mm.
That's the kidneys. So you can take your two fists and in the small of your back,
Oh, okay. So take
massage your
the
kidneys.
put them in the small of the back and massage
Yeah,
the
your
kidneys.
your
Okay.
your your wrists will, your fists will fit right into a kind of an empty area on the
Oh,
outside of the big muscles,
okay.
right in there.
And what
So
does that do when we massage the kidneys like that?
you stimulate the water element for the
Ooh,
kidneys.
stimulate
So
the water element. Okay.
yeah, so when you think about, let's say, if you're grilling, if you're not a vegan and you're grilling meat and your fire's too hot, you got to put a little water on it to cool the, you got to balance the heat.
Yes.
So
So
stimulating the adrenals, that's your water adrenal.
okay.
balances the heart energy.
Oh my gosh, these are great.
So
So, okay, so we take we massage the kidneys to balance the water element. If for anxiety, we massage the
yes,
between the two tendons, between our wrist and that, and then to heal digestion and overall vitality, we do four fingers below the kneecap and massage. These are amazing, and I'm going to upload diagrams. So in case anybody is still
great.
unsure, diagrams and instructions I'm going to add to through the Lens of Astrology Facebook group and to the Beacon of Light group. Well,
Uh,
Dr. Jeffrey Dann, this was such an incredible pleasure having you on. I just, you're just a beautiful example of an in balance Libra sun, Gemini moon, and Scorpio rising. You really have what you do is so pioneering. I'm recommending to everybody really look into this Koshi balancing system. It's so nuanced, so full of duality. I just love it. It's bringing beautiful holistic health and healing. So I just think it's amazing. I think that what you're doing is wonderful. And I'm just so glad you were so generous with your time and your talents today.
well, thank you so much. It's a pleasure and an honor to be on your show and to reach out through you.
Well,
Oh,
thank you. Well, that's our show. Until next time, enjoy and embrace transformation.